So my name is Dasgupta. In 2024, I relocated to Emory University as Killian Owen Distinguished Professor. My primary research focus is brain tumors, both in pediatrics and adults. The tumor is called diffuse intrinsic pontine glioma, or DIPG in short. It is a lethal brainstem tumor. Surgery is not possible, and so radiation is the only therapy available. The median survival of children is less than 1 year. We really haven't moved the needle yet. There have been many clinical trials, but nothing has been successful so far. My connection with DIPG, it all started at Cincinnati Children's. I remember the first time I received an autopsy tissue in my lab. The patient was a 19-year-old, and when she passed, I could not process the tissue. I was just frozen. That this was the girl who was alive and active. So one of the biggest problems for brain tumor drug development is that the majority of the drugs that are out in the market, they do not cross into the brain. And so we screened about 800 such drugs, and we have now narrowed down those drugs to about 15 compounds. Once we can narrow down those 15 drugs to about, say, 3 or 4 drugs, the pathway to a clinical trial will be much faster, because these drugs are already known. These are already known to have safety profiles in patients. We have also screened the drugs on the DIPG cells that we implant on brain slices. And then we test the drugs to see, in the context of the brain environment, which drugs will actually work to kill the DIPG cells without hurting the normal cells of the brain. The next steps are to now test these drugs in our mouse models to see, if they actually have a benefit in killing the disease and extending the lives of these animals. And from there, our goal is to take at least 1 or 2 of these drugs to clinical trial. We are testing a drug that's already given to leukemia patients, children with leukemia. And this drug is actually doing wonder in DIPG. And so we are also testing whether this drug is also effective in other pediatric cancers like medulloblastomas and ATRTs. Our plan is to take both of these to trial. So we're taking really all sorts of approaches, from drug screening to collaborations on organoids to talking to people at chemistry to develop new drugs and all that. But our goal is to find one drug or a combination with minimal side effects, so that we can at least improve the life of the patient and extend the lives, and at the same time, not interfere with the quality of life. That's really our goal. So in my lab, there are graduate students, and there are postdoctoral fellows, and there are research assistants. It really gives people like me this really stability and this flexibility to support a personnel in the lab who would be doing all this innovative research. Thank you for supporting our work through curing kids' cancer.